Hi friends, my pronouns to all. So before we start today's wonderful 11 days Santana Prapti Rastu workshop, a small announcement has been, we like to share a small announcement here, and that is about our beloved Dhyanaratna Nandaprasad sir. He has vacated his body today at 10:30 a.m. He has been suffering from heart attack from the past 3 days. So today morning, he has vacated his body. So I would like to say a few words about our beloved Nandaprasad sir. So he has been in Pyramid Spiritual Society as a backbone. Before he met sir, that is our Patri sir, he underwent many experiences in his own personal life, and he has achieved many successful things in his life. Before our Patrisa came into contact with him, he had a heart attack before itself. But same at that time, he came into contact with us, and after that, it has been a long journey with our Pyramid Spiritual Society's movement. All this happened in 1997. At that time, he used to have a magazine, computer center. In that center itself, a first magazine about our meditation, that is Dhyana Sagara. A magazine's DTP took place in his institute itself. So for that opening ceremony, sir attended his classes, his center. What he learned from Bhagavad Gita is that we should never cry for whatever the reason may be. So even now also, we should send him off in a happy mood, celebration mode. So friends, he used to have a diagnosis center also, endoscopy. Sir was a communist. He was a journalist. He had his news services. After his long journey, he married our beloved Madam Jayalakshmi. Even Jayalakshmi ma'am, after marrying to Nanda Prasad sir, she became a vegetarian. She used to do meditation for 30 hours also. Nanda Prasad sir did meditation for 18 hours at a sitting, friends. He had visited 400 ashramas totally. And he has spent 10 days of his life in Osho ashram also. In Vishakhapatnam, he established a sadhana pyramid center also. He visited Himalayas many times. Every year he used to go there with his family, with all our pyramid masters. Patrisa actually nicknamed him as Himalayan goat also. He used to love traveling. So he took many of our pyramid masters to Himalayas. So tours were his main interests. He took many of us there and did meditation with all of us there. So friends, he took an active part in Pyramid Party of India also. He met Lord Hanuman 3 times according to his specifications. It's a wonderful experience also. He did 100 episodes on Himalaya Parvam. It's just a wonderful experience as friends. He visited many countries also. Dhyana Mahachakram, a wonderful session that we attend every year at the time of December, is carried on by our great Dhyanaratna Nandaprasad sir. Now, one more thing, friends, he's a very good anchor. If he's on the stage, he makes us so blissful and happy state. Actually, the stage is we feel his wonderful jewel is kept on the stage when he is on the stage, friends. One more thing is, he is the managing director of our PMC channel, Pyramid Meditation channel. So, friends, he experienced near-death experience for 5 times, and this time he he thought that his journey has been finished on this Mother Earth, so he left us. So, friends, on this wonderful occasion, let us all sit in meditation for 2 minutes and say a goodbye to our Biraj sir. Please, everybody close your eyes and sit in meditation. Ma'am, will you play a soft music, ma'am? Just for 2 minutes, friends. Okay, friends, please separate your hands and place them on your closed eyes for 5 seconds. 5, 4, 3, 2, 1, and 0. Slowly open your eyes and have a look at your palms, friends. So this was a grand send off to Grand Dhyanaratna Nandaprasad sir. Thank you each and everyone for cooperating. Over to you, Swati ma'am.
Madam. Namaste, friends. Heartily welcome to all the participants today for Santana Praptirastu program presented by Divine Feminine Sangha with the blessings of Brahmarshi Pitamaha Patriji Garu and Swarnamala Patriji Garu. And thanks to Divine Pranahita Madam for providing wonderful platform to share knowledge of divine femininity. This particular program aims to provide wisdom related to conception, transform any negative beliefs you may hold, and help your journey into parenthood. Without much ado, it's my pleasure to introduce today's speaker, Dr. Nalini Garu. Dr. Nalini Garu is from Guntur, and she's a well-known person in our Divine Feminine Sangha. Dr. Nalini Garu is a professional gynecologist, and she's a great pyramid master, and she is in spiritual world from her childhood, and her main goal is to help people around and to do lots of services. She has helped thousands of children, women by sharing right wisdom about menstruation, menopause, and other physical, mental aspects. Divine Feminine Sangha platform, and her wisdom helped lots and lots of people who have and implemented her wisdom and changed thought process by following her guidelines. We all welcome you, Madam Nalini, Madam. Thank you. Over to you, Madam.
Thank you, Swati.
Thank you, Madam. Please continue.
And once again, let us all bid goodbye and let our great master Nanda Prasad Garu move to the higher planes for the higher spiritual work. And Asato ma Sadgamaya Tamaso ma Jyotirgamaya Mrutyorma Amritangamaya Om Shanti Shanti Shanti. Okay, friends. First of all, let us all thank Pranahita Madam for creating such a beautiful platform, Divine Feminine Sangha, to deal with the problems of and all aspects of women, so that we can share freely and discuss very openly about the female problems and also the divine femininity. So I welcome all the divine mothers here. I call you all the divine mothers because I believe that every woman is mother by herself, whether biologically a mother or not, because the quality of that motherliness, that nourishing quality, that loving nature, that forgiveness, that patience and compassion, whatever these divine qualities of a mother are present in every woman, I feel. So you are all divine mothers for me. And in the beginning itself, let us do a few minutes of meditation so that we can invite the spiritual babies, the divine souls, to enter our mother's wombs, and let us pray and invite the divine mother, the universe, to prepare our bodies, minds, and also the souls, all the panchakoshas. Let it be clean. So let us sit for a few minutes of meditation so that we can clean all the chakras and get prepared to invite the spiritual baby into our home. So please sit in a comfortable position. Close your eyes, clasp your hands, cross your legs, and be very comfortable. Take 3 long breaths. Relax yourself. And observe your natural breath. With each inhalation, feel and take in the divine cosmic energy from the universe to enter your body. The beautiful the pink love energies from the Divine Mother is entering through your crown chakra, the Sahasrara, that is from the top of your head, cleansing the blocks, the imprints, the memories from the past, and also from the past lives, all the karmas that are preventing you from becoming a mother. So we call all these chakras as energy centers in spirituality. And correspondingly, anatomically and biologically, they are connected to the endocrine glands that secrete the hormones that are necessary for all the body functions, including the fertility. So, you are taking that loving pink energy through your crown chakra, where the pituitary gland is situated, and it is the master of all the hormones, which controls all the hormones in the body, in your body, the thyroid, insulin, adrenaline, and including the ovarian and testosterone hormones. So let the energy clean the blocks there in the pituitary gland, your Sahasrara chakra. Let the energy flow freely and slowly let it descend to the Agnya chakra, that is in between your eyes, where we say the third eye lies. That is the place where the pineal gland is situated. That is in between the two halves of the brain. There is a very tiny, small thing called pineal gland, which secretes the hormone melatonin, which is a happy hormone, which relaxes our body and it induces the natural and a happy sleep. So let us cleanse all the blocks there and our egos, and past karmas. From there, let the energy pass down to your throat chakra, the Visuddhi chakra, where lies anatomically the thyroid and parathyroid glands. So, spiritually, it is a center of expression. Vaksuddhi we call. So, any disturbances in the thyroid hormone or parathyroid hormone, they affect the fertility. So, let the energy clean and balance the thyroid hormone and also the parathyroid. Each and every cell, let it get filled with the beautiful pink energy. And slowly we come down to the heart chakra, Anahata chakra, where the thymus gland lies, which is the center for the immunity. So let us all clear the blocks here, the lack of love, and also any defects in the thymus gland, and fill it with compassion, love, and then let us enter the navel chakra, the Manipura chakra, where lie the pancreas, the kidneys on either side, where the insulin hormone is secreted. So hyperinsulinism is also a condition which causes infertility. So let that also be balanced. And all the blocks and the karmic issues from the present life and also the past lives be clear. And now let us go to the Swadhisthana chakra, the lower abdomen, where the ovaries are there, the ovarian hormones, estrogen and progesterone. Any blocks there, let them be cleared. And let the energy clear all the passages there. Let it balance the hormones. And then down to the root chakra. The Mooladhara chakra. Which secretes the cortisol hormone. Is the fight or flight response of the body. So let that also be balanced. And all the fears, insecurities, and everything, and the past impressions be cleared. Each and every cell be energized, be ready to receive the divine soul, the divine baby. So let us all invite the spiritual soul from the spiritual baby world with the help and blessings of our divine mother, Mother Universe, the Mother Earth, Panchabhutas, and the astral masters. Let us be very positive. Again from Mooladhara chakra to crown chakra. Let us resonate with the vibration of the Bijaksharas. from Muladhara, Lam, Swadhisthana, Vam, Manipura Chakra, Ram, Anahata, Yam, Visuddha, Ham, Agnya Chakra, Om. And the crown chakra, Sahasrara. Last 5 seconds. Fill in your body with the divine energy, the positive energy. Five, 4, 3, 2, 1, and 0. Okay, friends. Relax yourself. Place your hands over your eyes and slowly open your eyes. And let us start the session. Welcome once again. So, as a spiritual practitioner and also a medical doctor, let me comprehend both the factors, both the physical and also the biological, and also the spiritual connection behind those problems, and try to attend to the issue of fertility. So, the fertility is mainly of two types. It is primary fertility, that means you never conceive, and the second fertility, you conceive once and then now there is a problem to conceive again. Maybe you have had one child or you conceived and aborted once. So this is called a secondary fertility. And before planning for a conception or to plan for a child, to bring the divine soul into this mother plane earth, you have to prepare yourself. The couple, they have to prepare themselves, both physically, mentally, at all levels, financially, and also the environment in the house, and the compatibility and the love and understand the friendliness between the couple. That is more and the most necessary factor. Let that the pregnancy should not happen as an accident, should be by choice. So marriage also, it should be like everybody is getting married. I too should get married. Let that not be the concept. So it should be a selective thing, and we know that every soul has a design, and it does in this lifetime. If you have selected a one partner and your soul designs to have a child, to bring a child into this world, then the plan will be according to that. So if you are not having any children, means that also will have a background. You know that we create our own reality. So uh, we all know as meditators that we create our own reality. So our soul will decide to have the whatever life we are leading now, and whatever problems are the assets in our life, they are planned according to our soul's design. So don't get disheartened. uh, you 100% you will all have a successful pregnancy and conception, and have a beautiful children in your life. But what I'm trying to say is, because sometimes your soul may decide in the, maybe in the according to your previous births and previous experiences in your past lives, not to have children in this life, so that you can have a more scope to do service or spread meditation or whatever it is. So you might have chosen like that, but again you have a free will, so you can change that. If you want to have a child now, you can now decide again and plan for that and change the thought pattern. Everything is decided. How you create a reality means by your thoughts and your emotions. So by changing that and making all the panchakoshas and the seven bodies and everything, body, mind, and soul, this is a complex, no? The whole thing should be in alignment, and then when you plan, it will become a great success. So whatever be the plan, you can plan now and you can change that plan, and plan accordingly to have a beautiful child. Okay. So as I said, every mother is every woman is a divine mother, whether it be a biological mother or not. You are a mother, and when you can accept any child as your own child, that is very great, no? Mother Teresa, we say, and Ma Sita, and Ma Parvati. Why we say the Mother Isis? Why we say so? That motherliness should be there. That is the primary and first requirement for a woman to become a mother. And also, the husband and wife, the couple, should have that friendliness and that love, that bondage between them before they plan for a child. Okay. And they together they should plan and invite the divine soul. All these things, I think the other masters must have told you. And let me discuss the factors behind the fertility issues. There will be male factors and also the female factors. Both are equally important. The male factors will be some ejaculation problems, or sometimes there will be some varicocele will be there, which will be upsetting the seminal flow, and sometimes the count will be less, the semen count will be less, the spermatozoa will not be in sufficient quantity. Sometimes the motility will be less. That means they should swim and reach the ovum to fertilize, no? So that motility will be less. They won't be so active. So at that time also the issue comes. And sometimes the structure of the sperm itself will be defective. So some maybe genetically or with the age, there will be malformations in the spermatozoa. So that also causes the infertility. So first of all, the basic tests you have to undergo, both the couples should go to the doctor. When you call, there is a problem, means for a consecutive 1 year, if you are not following any family planning methods and you are having regular intercourse, that is at least twice or thrice in a week or so, still you are having any issue, means not using any contraceptives, means then you have to go for the basic checkup, both the couple, not only the woman and not the man. So both the couple should go to the doctor and get the basic test done, so that they can find out the cause. When the cause is known, no, the treatment is very, the solution will be there. So no, everything, for everything there is a solution. So no problem. So these things can be attended to. Varicocele, the small minor surgery can be done, and with the spermatozoa count also, there are medicines, they give the medicines and to improve the quality and the quantity of the spermatozoa and all. And certain precautions from your side also you have to take. That is the, and nowadays, no, with the technology, the laptop they are using, no, they should not put in the on the lamp, so that because of the heat and also the radiation, the sperms will die, the testes will get affected, and the testosterone hormones and also the spermatozoa will die. That's why you should not keep the laptops or the lap. I should not wear the tight jeans and all. The Indian wear, no, is very actually really very comfortable. So all these things, and also you should not smoke meals, and should not drink alcohol. You should not take, and too much of coffee and tea. They are not good, and carbonated drinks are not good both for man and woman. And a healthy diet habits, and a nice balanced diet, and a vegetarian diet, strictly vegetarian diet, and high protein diet, and with all the nutrients, and the balanced diet you should take, and lot of liquids and water, and these almonds and nuts, they are very good to increase the fertility. So these precautions should be taken, and also the obesity is not good, and should do regular exercise, yoga, or any cardio or gym or whatever it is, whichever is of your convenience. You have to keep your body fit. And one one thing you should remember: the age of fertility, the will be reduced after 35 years, 35 to 40 years. So you should plan during the high fertility age. Okay, it should not be too young or too old. That is the thing. And also from the in the female side, there are mainly 4 factors. From the, the uterus will be there, tubes are there, and ovaries are there to produce the ovum, and also the opening of the uterus, that is the cervix, we call, no, that cervix will be very tight. It will have that opening as pinhole opening. Congenitally it will be like that, so the spermatozoa cannot enter the uterus. So that will be the problem regarding the cervix. Certain times there will be infections in the cervical canal, that white discharge, and some fungal or bacterial infections will be there. They prevent the spermatozoa to enter the uterine canal and the fallopian tube to fertilize. So those issues should be attended to. They are very simple. And also sometimes that secretions will be there, no? That mucosal secretions, that sticky white discharge will be there, which will enable the spermatozoa to swim and enter into the fallopian tube. So If that quality is not good, no, the vagina is very dry and cervix doesn't secrete the necessary amount of secretions, that also will be a problem. So these are the cervical reasons. Sometimes some polyps will be there, small small growths will be there. These also should be attended to. And the uterine factors are the uterus where the baby grows and stays there for 9 months. So the endometrial lining should be normal, and certain times the small muscular lumps will be there, tumors will be there. They're called fibroids inside the uterus or in the wall of the uterus. They're very small. There'll be no issue. Otherwise, you have to get the surgery done and remove that fibroid, so that the baby will have space and the right environment to grow there. So fibroids will be there certain times, and then any other tumors can be there. And in the tubes are the main issues, from where the ovum will get released and travels through the tube and gets fertilized with the spermatozoa and enters the uterus and gets implanted there. So any blocks in the tube or any swelling or any water collection in the tube will hinder the fertilization. So you have to get an ultrasound done, very simple test, or histosalpingogram, where you can know that whether the tube is blocked. The cause for the blockage is the previous infections or any other surgery in the abdomen may have created some adhesions and blocked the tube. One tube is also is blocked also, means one tube is patent, means it will be okay. So, and then coming to the ovarian issues, the regular ovulation should be there. Every menstrual cycle will be releasing one egg from each ovary. This month is the right side, means next month will be from the left ovary. The ovum will be released, and if we don't get pregnant, it will come out in the menstrual period in that blood. So those issues, the ovulation will not happen normally, and the follicles won't mature completely, and they will form into small cysts. They call polycystic ovarian disease or polycystic ovarian syndrome, they call. So small grape-like structures will be there, which won't get mature completely. So the ovum will not be released regularly, and they won't get periods also regularly. They will have irregular periods every 2 or 3 months or 6 months, like that, unpredictable. So you cannot plan when the ovulation comes, and the ovum won't be available even if they are having the family life. So there will be issues in conceiving. So for all these factors, no, there is a spiritual connection. How means these are all the physical issues, a doctor or by examination or by conducting tests, it will be knowing. But why all these things happen means 99% we don't accept our femininity, we don't accept our womanhood, we feel inferior. From the childhood itself, from the generations together, we are taught like that, and we have the thought process and the wrong impressions and the beliefs, and all these things are carried on. So we feel inferior to men, and we hate our periods, we hate our femininity. We don't want to express our femininity. We hate our reproductive organs, and we don't respect our reproductive organs or our femininity or our breasts, which feed the child. So we feel very shy, or we resent that those periods, the bleeding, and we hate that, and we get irritable. Why we are having all this? Because men are very free and okay. We should not have born like a girl. All these things, all these thoughts are very much imprinted in our subconscious mind. So all these factors, when we hate certain things, no, they won't come to us. We don't know that at that age, the periods and all, no, they are the it is the basic reason, and it is designed for the future motherhood, that we don't know the fact of the scientific reason why we get the periods. There are, because of the ovulation and preparation for the motherhood, we don't know that. So we hate that periods, and we think that it will be good if I don't get periods. It will better, it will get delayed and all. And for all the reasons, if there is a festival in the house, or any function is there, or we are going to a temple or puja, or for anything, we take the pills. Inadvertently, we take the pills to postpone the periods, and we feel very happy. We are free. No disturbance is there like that. But what those pills contain? They contain the hormone. The hormone balance is very delicate. Balance will be there. Any simple imbalance will create great turmoil in the whole body. Not only the ovaries, the heart, thyroid, insulin, everything will be disturbed. So we don't understand that. So simply we take pills to postpone our periods and all. So what they will do, they will suppress the ovulation. At that time, it would have been okay, but later on, as the age goes, you develop this PCOD problem, and you won't get regular periods. I come across many patients, many girls, teenage girls with this problem. Nobody is getting the regular periods of 28 or 30 days cycle. So they depend on the forcible ovulation. They have to take the tablet, then only they get the periods. So all these things happen because of the mind, no? The mind acts, our thoughts and emotions, they control our body and the hormone. That's why I said that this pituitary, which is situated the pineal gland, all these glands, they control all the other hormones of the body and also the well-being of the person. So whatever our thought goes in and acts in the subconscious mind, it will reflect in our body by having the disturbance and imbalance. So we have to accept that femininity. We should respect ourselves and respect our periods, the menstrual cycles, the purpose of the purpose behind it, and we had to be thankful to the mother nature that we are born as a woman. We are the creators, no? We are next to God, so we have to respect ourselves. So change your thoughts and change your perception of looking at things. Then automatically these things have been practically done in our feminine Sangha group members, and so many people got benefited regarding their getting menstrual pain, and also the premenstrual syndrome, that is before the periods they get headaches and mood swings and all these problems, and menopausal problems, and also these fertility issues. All these things will be attended to if you have the right perception and have the positivity in yourself. So this hormonal balance will be maintained properly through your thoughts and emotions. Once again, I'm repeating, it's not only the medicines, through your thoughts itself, and by doing meditation and controlling your thoughts and minds, and letting go of all negative things and preconceived notions and wrong things from your mind, you can achieve that right balance. If necessary, you can take the help of the doctor or slight medications so that it will get normalized. So this PCOD problem and also over bleeding or scanty bleeding, all these things um, can be attended to by having these positive thoughts. And also one more thing is this obesity. You have to be physically fit also. All these panchakosas are important. Annamaya kosa, pranamaya kosa, and you have to take the proper food, balanced food, vegetarian food, the vegetables and fruits, nuts, and seeds, lot of water and liquids you have to take, and do proper exercise of your choice and play games and all, so that your body is fit. And the lower abdominal fat is not at all good to conceive that lower abdomen fat. No, we advise people to do some yoga asana, Baddha Konasana, and Pavan Muktasana, certain asanas are there, Surya Namaskaras, all these things. Vitamin D is also very important for fertility. So you have to get yourself exposed to sunlight, and if not, you can take fortified cereals or something with vitamin D, and calcium is also necessary. And you should have sufficient iron in your body to have that hemoglobin uh, to be fertile. So you have to take a lot of leafy vegetables and all these things. Eat healthy and do proper exercise, relax yourself, and have nice hobbies of your choice, which are you're passionate to do. You do the things of your liking, which you love most. That gives that fulfillment and that happiness, releases those heart happy hormones, and that estrogen, progesterone, thyroid, everything they will be balanced and fall into place. So all these things are necessary. Proper exercise and diet, and also have to be peaceful, and you have to be positive. And the woman, I advise certain fruits, and that like papaya or pineapple, they contain certain enzymes which may reduce these hormone levels. So try to eat them lesser quantity, need not avoid completely. And sesame seeds and badam and peanuts, and also these omega-3 fatty acids. They contain not only in fish. You need not take non-vegetarian food for this, and for protein also we can eat lot of legumes and grains to get the protein, and also leafy vegetables to get that iron. And this jaggery contains lot of iron, and also curry leaves and moringa leaves. They contain a lot of calcium and iron also. And flax seeds, and also this pumpkin seeds, and chia seeds, sabja, all these things. You can dry roast them and take 1 tablespoon full of thing one day, once per day, or you can soak them and eat. All these things contain omega-3 fatty acids. They are very good for men and women also, to increase your fertility. All these things you have to take. Instead of taking always the medicines, you try from your side regarding these factors, and go to the doctor and know whether there is a problem in the cervix, or in the uterus, or is there any block in the tubes, or is there any problem regarding the ovulation, or PCOD problem is there for ovulation? If you are not getting normal periods in spite of doing yoga asanas, or getting your obesity reduced, or other things, they may give some tablets like clomiphene citrate, like that. to induce ovulation, to facilitate that ovulation ovum release. So, and you must remember that after the age of 35, that number will slowly decrease, because the female will have a certain fixed number of follicles and wombs when she is in the mother's womb itself. So that number is fixed. So as the age progresses, the chances of fertility will be less. So you may have to take the assistance of the gynecologist to guide you properly. And the time, the fertility time also during your menstrual cycle also, where you should have that family life and have that intercourse. They will advise you. Usually the ovum will survive for around 12 to 24 hours. So you will be ovulating in the middle of your cycle. Usually if it is 28 days of cycle is normal. In that case, around 13th or 14th day will be ovulating. So for some people, it will be 82 days cycle or 90 days cycle, like that. So we have to deduct 14 days from that time. So I come back to that 14 days back to that time. Around that time will be roughly the ovulation time. So during that time, you have to be together, and there will be the chances will be more. So you should plan that you should not have any camps outside, and you should be there together during that ovulation time and all. You should plan. So there will be you will be knowing also by observing your body. You will be having slight pain in the lower abdomen, or the nature of the cervical secretions. It will be a bit sticky, and you will know that consistency. So okay, you will know that yeah, I am ovulating today or tomorrow. This is that time we should have intercourse, like that. So the sperm will be there for 3 days, 72 hours or so. Sometimes it will be for 5 days. But the ovum will survive only for 24 days. So during that time, today the ovulation is today and tomorrow will be the right and the top fertility time to get conceived. So you have to follow that cycle also. Sometimes you can use that thermometer, and there will be half degree to 1 degree temperature variation. There will be a raise in the temperature. Basal body temperature means immediately after getting up from the bed, not even after brushing or going for the washroom. Just after getting up from the bed, you have to take the temperature, and there will be a change. So you can assess by that also. Certain strips also are there, reagents are there, so that you can put it in the urine, and you can know when you are ovulating. So you can follow that. So all these things are the things you have to observe to get a baby. And at certain times, 50% of the times it will be the problem with the male, 50% of the times it will be with the female. Sometimes both the in problem will be there in both the couple. A certain time there won't be any problem also. It is called idiopathic. There won't be any problem. Everything will be perfect, but they won't be able to conceive. So especially for these people, the meditation helps very much, because it is beyond any any scientific reason. No? So you have to sit during the night and hold your hand, both the couple, and pray and do meditation, and you have to invite that spirit baby. And because the we also have selected our parents, our house, our environment, our in which country I should born, and all according to our soul design. We are born to our parents. The same way the spirit babies, now the babies are there in the spirit world, they are very great masters. The coming up masters are there. So they want to evaluate the earth so very quickly. So they are very eagerly waiting to enter into the earth plane. So now we should be ready, and they have to choose us, no? So we have to be that worth. So we have to clean up our all the emotions, our physical body and mind, our thought process and all, both the couple. So and they have to stop smoking, drinking and non-vegetarian, all these things, and get ready and be prepared first. Be prepared first to have the child and invite the child and wait for the child to come. Let it, please give some time, be patient and be positive. Uh, so this is what I want to tell. And as the age advances, I told you, no, when the population is not there properly, they will give medicines to induce ovulation, and that womb is very precious, no? So sometime they will do follicular tests and do the uh, induce that ovulation. And during that ovulation time, what they will do is IUI, they say, because sometimes there will be a problem for the spermatozoa to enter and fertilize the egg. So that time is very precious, no, as the age advances. So what they will do is they will wash the spermatozoa and clean up, and they will select the best spermatozoa, and then they will introduce into the uterus of the woman, so that the fertilization will happen successfully. So they will try that first, and certain times they will do in vitro fertilization, where they will fertilize the womb and the spermatozoa outside, and then when the zygote is getting formed, they will introduce into the uterus. All these things, their science is very much advanced, but I advise don't go for it for too many times, because all these drugs, no, to induce ovulation or to increase the spermatozoa count, they will have their own side effects. So, and meanwhile, you have control over your, thyroid and your sugar levels and diabetes and hemoglobin, all other factors of the health. You keep them at optimal levels, and then plan for the pregnancy. If by God's grace, if you are getting a child, it's okay. Otherwise, also don't get disheartened. As I am saying, no, we're all divine mothers. We're all having that motherliness. So be positive and be ready to accept any baby, whether it is a boy baby or a girl baby. Accept to have the child, and I wish you all the best. So any other questions or experiences, if you want to share, you can share with me. Friends. I think somebody is raising their hand. Can you please unmute?
Yes, ma'am.
Pati?
I'm Vaishnavi.
Okay, Vaishnavi.
Yeah, ma'am. Good evening, ma'am.
Good evening.
I have got a pregnancy 3 years back.
Yeah.
Okay. In the time of pregnancy, the doctors have said in the two ovaries, both the ovaries, I have hair and the small teeth and all. So,
Yeah.
They have, I mean, first, for the first time, they called my husband and they said that in this one ovary, there is a hair follicles and it, we have to remove that and it
Yes,
is not good for health. And they said,
yes, yes.
after 15 minutes, again they called my husband and
Yeah.
without any thinking, my husband said, okay, take it off that also. Now I don't have,
The ovaries.
no, I don't have any ovary.
Oh, both the ovaries they have removed. Huh? What?
They have removed. In that meanwhile,
Because only one ovary you said you are having that hair growth and all, no?
first they said only one. Again,
Okay. Okay.
again they have said that in another ovary also same thing has happened.
Yeah, yeah. This happens constantly, ma, because genetically, by birth itself, we have developed those things. It is called a teratoma. It's a type
Okay.
of tumor. Instead of growing the normal tissue, the hair should grow on our head, no, and also the
Yes.
other places. Teeth should have grow here, no.
Yes.
Because of some metamorphosis, wrongly they will develop there. Some people will have some extra finger like that, no.
Yes. 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 Yes.
In ovary, in your mother's womb itself, it happened. So with your
Okay.
age, they have grown in size. They're not good to have them because I don't know whether the doctor has told you or not, because slowly they may become cancer.
Cancer. Yeah, she said. She said.
At later age, it will be a problem.
No,
So
by means, what I'm saying is, if she has given one chance to check from the another doctor, it may go through laser treatment means it will be good for me. I mean, she doesn't suggested me that you can go for the another doctor or any other chance, and she did not
where
never
are you
say.
staying, ma?
Sorry,
Where do you stay?
I
Where
stay
are
in Ongol. Ongol itself.
Ongol. Oh,
Yeah.
India only.
Yeah,
Okay.
India. And then in the
Then
meanwhile, she kept.
Prayer center, they should have sent you. Yeah,
In
that's
the
suggest you not only you take always a second opinion. If you have a doubt,
yes,
take a second opinion. So that
yeah,
and take some time. It's not an emergency, If an
yes,
emergency surgery, it's okay. Otherwise, you can take your own time. You can inquire whether there are any advanced treatments for everything. Even for fibroids, they used to remove the whole uterus before. Now only
yes.
the fibroid they will remove, and also by laparoscopy they are doing. The things are becoming very fine nowadays. So no problem. Don't worry. And
I
if
have one baby girl, man.
you have one baby, then good.
Yeah, yeah.
Because you have one baby.
After taking her outside, and she checked
Okay.
in my
There is no
pregnancy, and
problem.
in
You're very fine. You are safe, and your baby is having her mother life. No, that is more important. Okay,
then
my
in the meanwhile, there is a story also because and she had kept the cloth inside my stomach, and she
uh-huh.
forgotten that.
Oh,
And it take 15 days to observe that. She have taken all the x-rays, UG, and everything, ultrascan, but she did not, she don't have any thought to take CT scan.
okay.
And at that time in our Ongol, only Sunday is on the leave, that CT scan hospital. So we
Oh,
went for the Manipal hospital and we admitted there, and it takes time. And Monday they have surgery me. August 6th, my baby has born, and August 26th, again I got a surgery.
second time you had to undergo.
Yeah.
Okay.
So my final question is, by God's grace, that miracles may happen. So if I do the meditation, I can gain a spiritual baby or not?
No, because there is no ovary to that ovum is required, no? That is the
Okay.
is it that ovum should get fertilized with the spermatozoa. You can have any other's ovum. There are those procedures also are there. No, you can take some frozen ovum
Yeah.
from the other lady. If you
Okay.
are willing to, if you are both couple are willing to have that, then you can borrow an egg and get fertilized with your husband's spermatozoa, and you can have a child, second child. Are you eager to
Okay.
have another child?
No,
And
but
it's like
I want. Sorry, ma'am.
just for you are having a doubt for whether you can have a child or not, or are you eager to have another child?
I mean, I'm not eagerly, but I need, by God's grace, spiritually, I want to take, not any other this IVF and all. Miracles may happen. I'm waiting for that.
Okay. Spiritually, baby means what? Spiritually, it's not a biological or physical baby, isn't it? Spiritual baby means you may adopt an orphan girl or a orphan boy or any spiritual connection if you find with somebody. This are
Okay.
a animal also, a plant also. There also
Okay.
are living beings who are in need of somebody's care, that motherhood, isn't it? That's what I tell you. You can adopt a nurture a animal or an orphan or a plant and
Okay.
nurture with your that mother's love. That is spiritual, no? That is not physical, isn't it?
Okay.
Are you understanding what I'm saying?
Yes, I understood.
In
I
each
mean, show love like that.
child. Yes.
Okay, ma'am.
Whatever happened, it also happened for your experience, for your soul's evolution through this experience. Don't think about that experience. You just think what lesson I'm going to learn through
Yes.
this experience. Always think like that. Don't
Yes.
have that
Yeah,
that hurt or that trauma with you. Don't carry it. Let
no.
it go. Let it go. Let it go.
It has happened about 3 years. Now
Yeah.
my baby entered into the 4 years, but just I'm asking, as you are a doctor, no? So that I'm asking you a question.
Yeah.
That's it.
At
Thank
present,
you.
there are no things because if both the ovaries you are not having, no, you can have egg from somebody else and you can have a child because your uterus is intact. Some surrogacy, all these things are there. If you are, if you can have that, you should have an open mind and some issues will also be there, legal issues. All these things you can attend to and you can have.
Ma'am,
Yes.
one thing.
Yes.
Can you say about periods, ma'am? I mean, I'm getting regularly for the 6 months, I can get regularly monthly once.
Yeah.
And few months, 2 months, monthly, 2 months for one. Like that, I mean, gradually it is decreasing. It is not coming as an orderly like that.
It will happen. It will happen because the ovarian hormones are not there. No, it will slowly decline and it will stop.
Oh,
Yes.
okay. Thank you, ma'am.
Next, anybody is there? Swati, anybody is there? Hello? Hello?
Ma'am, I think some issues are happening. Wait for 2 minutes. She's
Yeah.
checking.
Okay.
Can you please talk Balika Poker, please? I will unmute him.
Hello.
Yes.
Hello, ma'am. Ma'am, we have other two people, ma'am. Please,
Yeah. Let them open their video also.
Okay. Vaishu, will you please unmute Krishnata?
Hello, ma'am.
Hello. Yes. Hello. You are not audible, ma. You please unmute. I am not able to hear you.
Hi, ma'am.
Hi. Tell me. Yes, ma.
నాకు హెవీ బ్లీడింగ్ ఉంది మేడం, హెవీ బ్లీడింగ్ అవుతుంది.
ఓకే మా. ఏజ్ ఎంత మా?
36 మేడం.
36.
అయితే ఫస్ట్ ఒక బేబీ ఉంది, తర్వాత తనకి ఇప్పుడు 9 years.
ఓకే.
అయితే ఫైబ్రాయిడ్ ఉండేది, అది రిమూవ్ చేసుకున్నాను నేను 2 years ముందు.
ఓకే మా.
2 years తర్వాత నుంచి ప్లాన్ చేస్తున్నాము. ఫైబ్రాయిడ్ ఉన్నప్పుడు 1 year నుంచి ప్లాన్ చేసాను, సక్సెస్ అవ్వలేదు, అది తీయించేసుకున్నాను. తర్వాత ఫైబ్రాయిడ్ తీయించుకున్నాక ట్రై చేస్తున్నాం 2 years నుంచి, కానీ సక్సెస్ అవ్వట్లేదు అనమాట. బ్లీడింగ్ కూడా చాలా హెవీగా అవుతుంది, కానీ స్టాప్ అయిపోతుంది. 3 days అవుతుంది హెవీగా, స్టాప్ అవుతుంది. చాలా హెవీ అవడం వల్ల తల తిరగడం, ఎనీమియా
ఉంటుంది. లెట్ మీ టెల్ యూ వన్ థింగ్. ఇప్పుడు ఫైబ్రాయిడ్ రిమూవ్ చేసిన తర్వాత మళ్ళీ ఒకసారి రీసెంట్ గా ఇంకొకసారి గెట్ యువర్ స్కాన్ డన్ అమ్మా. ఎందుకంటే ఒకసారి ఫైబ్రాయిడ్ పోయిన తర్వాత మళ్ళీ ఇంకో చోట ఏమన్నా వచ్చింది, బికాస్ వై యు ఆర్ హ్యావింగ్ హెవీ బ్లీడింగ్ అనేది తెలియాలి ఒకటి. రెండవది, సమ్ టైమ్స్ ద ఎండోమెట్రియం ఉంటుంది కదా యూట్రస్ లోపల లైనింగ్, అది బాగా థిక్ అయిపోతుంది. అది ఉంటే కూడా హెవీ బ్లీడింగ్ ఉంటుంది, ప్రెగ్నెన్సీ రాదు. అప్పుడు ఒకసారి డిఎన్సీ చేసి క్లీనింగ్ ఏమైనా చేయాల్సి రావచ్చు. అండ్ అటెండ్ ఎనీమియా, బాగా ఐరన్ కంటెంట్ ఉన్నవన్నీ తీసుకోమ్మా. అండ్ ఒకసారి
స్కాన్ చేయించుకున్నాను మేడం. అయితే ట్రీట్మెంట్ కి 4 months నుంచి వెళ్ళట్లేదు, ముందు వెళ్ళే వాళ్ళం, కరోనా వల్ల వెళ్ళలేకపోయాం. అప్పుడు స్కాన్ లో అంతా నార్మల్ ఉంది అని చెప్పారు అనమాట. బ్లీడింగ్ అంటే అవుతుంది కానీ ప్రాబ్లం ఏం లేదు, యూట్రస్ అంతా బానే ఉంది అని చెప్తున్నారు అనమాట.
హస్బెండ్ సైడ్ అంతా ఏం ప్రాబ్లం లేదమ్మా.
మా వారికి స్పెమ్ కౌంట్ ఎక్కువే ఉంది, మోటివేషన్ లైక్ తగ్గింది కొంచెం అని చెప్పారు.
తగ్గినప్పుడు ఏం చేయాలంటే, అది నేను చెప్పాను కదా ఇందాక, వాష్ చేసి చేస్తారని చెప్పేసి అది ట్రై చేయండి. యూబీఐ ట్రై చేయండి.
ఐయుఐ 1 time ట్రై చేసాము.
ఐయుఐ ట్రై చేయండి ఒకసారి.
ఐయుఐ 1 time ట్రై చేసాము 3-4 months బిఫోర్ అన్నమాట. అది ఎగ్జాక్ట్ డేట్ వచ్చేసింది, మరి సక్సెస్ అవ్వలేదు. 25 days కి నార్మల్ గా డేట్ వచ్చింది.
ఓకే కొంచెం గ్యాప్ ఇవ్వండి. మీన్ వైల్ ఏం చేస్తారంటే అమ్మా, ఒక 2 months మీరిద్దరు నైట్ టైం ఇద్దరు యూ హోల్డ్ యువర్ హ్యాండ్స్. తను మెడిటేట్ చేస్తారో లేదో నాకు తెలియదు, బట్ కొంచెం చెప్పి తనతో కూడా ఇద్దరు కలిసి మెడిటేషన్ చేయండి. తనకి ఏదైనా స్మోకింగ్ కానీ డ్రింకింగ్ కానీ అలవాటు ఉంటే నాన్ వెజ్ ఉంటే మానేమని చెప్పండి అమ్మా. అండ్ ఎవ్రీ డే యూ ఇన్వైట్ దట్ బేబీ, స్పిరిట్ బేబీని ఇన్వైట్ చేయండి. మేము చాలా ఈగర్ గా వీఆర్ వెయిటింగ్ ఫర్ యూ అని చెప్పేసి చెప్తూ ఉంటే తన మెసేజ్ కూడా ఇస్తుంది మీకు డ్రీమ్ లో కానీ ఎప్పుడున్నా కానీ, ఎస్ ఐఎమ్ కమింగ్, ఇప్పుడు వస్తున్నాను అని చెప్పేసి ఇండికేషన్ కూడా ఇస్తుంది. యూ విల్ బి డూయింగ్ మాస్టర్స్ తో ఒకసారి కనెక్ట్ అయ్యి మాట్లాడుతూ ఉండండి. తప్పకుండా మెడిటేట్ చేయండి అమ్మా, ఎందుకంటే పెద్ద రీజన్ నాకేం కనిపించట్లేదు కాబట్టి. ఏజ్ కూడా మరీ ఎక్కువ కాదు మీకు, సో దేర్ ఆర్ ఛాన్సెస్, కానీ ఛాన్సెస్ కొంచెం తక్కువ ఉంటాయి. కానీ
ఫస్ట్ మంత్ లోనే వచ్చింది. తర్వాత ఈ ఐరన్ హెవీ బ్లీడింగ్ కంట్రోల్ దాని వల్ల చాలా వీక్ అయిపోయింది అనమాట.
అవునమ్మా అవును. ఖర్జూరము, ఎండు ద్రాక్ష, రాగి, బెల్లం, మినపసున్నుండలు, మునగాకు పొడి, తర్వాత వీట్ గ్రాస్ పౌడర్ ఉంటుంది కదా, అది ఇవన్నీ తీసుకోమ్మా. ఐరన్ బాగా బ్లడ్ ఒంటికి పడుతుంది చక్కగా. ఆ టైంలో కొంచెం రెస్ట్ తీసుకో, ఎక్కువ హెవీ బ్లీడింగ్ కాకుండా.
మేడం వాటర్ లాగా వచ్చేసింది అనమాట, బ్లీడింగ్ క్లాట్స్. ఈ మధ్యన ఐయుఐ చేయించుకున్న తర్వాత క్లాట్స్ లాగా అయింది, దారి లాగా వస్తుంది అనమాట బ్లీడింగ్ అనేది. సడన్ గా 2 సెకండ్ ఎక్కువ అవుతుంది ఫ్లోటింగ్ అనమాట.
ఓకే ఓకే, నో ప్రాబ్లం అమ్మా, ఏం పర్వాలేదు. మెడిటేషన్ చేస్తూ యూట్రస్ లోపలంతా క్లీన్ అవ్వాలి, నా ఓవరీస్ కరెక్ట్ గా ఓం రిలీజ్ అవ్వాలి, అంతా ఇక్కడ ఉన్న బ్లాక్స్ అంతా నేను చెప్పాను కదా, స్వాదిష్టాన చక్రం మీద ఫోకస్ పెట్టుకుని ఎనర్జీ అంతా అక్కడికి వెళ్తున్నట్టుగా చేసి యూట్రస్ ప్రిపేర్ అవుతుంది, నేను ప్రిపేర్ చేసుకుంటున్నాను అని థాట్ తోటి సిట్ ఫర్ మెడిటేషన్ అమ్మా. ఎంత ఎక్కువసేపు మీరు ఉంటే అంత ఎక్కువసేపు మీరు చేయండి. నైట్ టైం మటుకు ఇద్దరు హస్బెండ్ అండ్ వైఫ్ ఇద్దరు కలిపి చేయండి. నేను చెప్పినట్టుగా ఆ ఓవ్యులేషన్ టైంలో మీరు ఫాలో అవ్వండి, ఇద్దరు కలవండి, అది చాలా ఇంపార్టెంట్.
స్పెమ్ కౌంట్ పెరగాలంటే ఏం ఎక్కువ తినాలి మేడం, దానికి మోటివేషన్ పెరగాలంటే?
పెరగాలంటే నేను చెప్పాను కదా, ఫ్లాక్ సీడ్స్, బాదాము,
దానికి కూడా అదే
బాదాము, చియా సీడ్స్, డ్రై ఫ్రూట్స్ ఏవైనా సరే, మంచి ఫ్రూట్స్, వెజిటబుల్స్ ఇలాంటివన్నీ బాగా తీసుకోమని చెప్పండి, కొత్తిమీర ఇలాంటివి.
సరే మేడం, థాంక్స్.
ప్రోటీన్, మంచి ప్రోటీన్స్ ఏదైనా సరే, సోయా ప్రోటీన్ కానీ, సోయా వద్దు, సోయా కాదు, మిగతా తీసుకోమని చెప్పండి.
సరే మేడం, థ్యాంక్ యూ.
యాక్టివేట్ చేయాలి, పాజిటివ్ గా ఉండాలి.
Good evening, madam. Just to add one more thing.
Yes.
Then problem అని చెప్పింది కదా, before that, right, I had a kidney stone actually. Will it impact kidney stone? It was removed actually. So will it impact in the?
మీకండి?
నాకేనండి.
నథింగ్ టు డూ విత్ ద స్పెర్మటోజోవా. అసలు ఆ పాత్ వేరే, ఈ పాత్ వేరండి. నో ప్రాబ్లం, నో ప్రాబ్లం, నో ప్రాబ్లం. డ్రింక్ మోర్ ఆఫ్ వాటర్ అండ్ లిక్విడ్స్ అండి.
ఓకే,
తీసుకుంటే మీ మొటిలిటీ ఎక్కువగా కూడా పెరుగుతుంది, అండ్ మళ్ళీ మీకు స్టోన్స్ ఫామ్ అవ్వకుండా ఉంటుంది.
దానికోసం కేర్ తీసుకున్నా, బట్ దీనికి ఏమి ఇంపాక్ట్ ఉంటుందా?
అసలు ఉండదండి, అసలు ఉండదు.
థ్యాంక్ యూ మేడం, చాలా బాగా అన్ని ఎక్స్ప్లెయిన్ చేశారు.
అయ్యో, థ్యాంక్ యూ, వెల్కమ్ సార్.
థ్యాంక్ యూ.
Yeah, hi ma'am, good evening ma'am.
Hi, good evening.
Actually ma'am, my name is Bhavika and I'm 32 years old and I have a baby for 4 years old.
Okay.
And we are trying for second baby.
Yeah.
So it's been 6 months we are trying.
Yeah.
After that we went to consult a doctor.
Yes.
So we had all the tests. So in that I have a vitamin D deficiency, ma'am.
Yes, that's what I was telling. Go into the sunlight and take, if necessary, you can take vitamin D supplement 60,000 units once a week, ma. You can take.
60,000 units.
Yeah, 60,000 international units. Capsules will be there, and once a week you can take. You take the advice of the doctor also, and you can take. And move in the sunlight. Where you are staying, I don't know.
Hyderabad, ma'am.
Hyderabad, you can get sunlight, no? It's in India only, and you just move about in the sunlight and take calcium also. And seeds are there, very important. All these sesame seeds are there, no? Sesame seeds.
Yeah, ma'am.
Sunflower seeds, pumpkin seeds, melon seeds, all these seeds, take one spoon every day and chew them and just swallow. You can get nice of vitamin D. It's very good for your bone health also.
Yeah, actually my backache also, it's more, ma'am.
Yeah.
In
also will go.
And I'm having a tablets weekly once, Gen D3 Nano, ma'am.
Yeah, they are the vitamin D only. Yeah, you take them. In the
Actually, I have a question. Means my vitamin D is lower level.
Yes.
So we are trying now.
Yeah.
So should I first increase my vitamin D level? Then I should try.
Yeah, wait for 2 months and then again check your vitamin D levels. You are taking weekly once, no? Then it will get improved. Otherwise, the baby's spinal cord and the baby's bones also will get affected, no? So let it improve first and then try.
Yeah, ma'am, that's what, ma'am. I was having a doubt. Should I continue trying or I should first increase
No,
my
wait for 2-3 months.
Okay.
Get your
Okay,
vitamin
ma'am.
D. When it is normal, then only you try.
Yeah. Okay, ma'am. Thank you, ma'am. Thank you for information.
Anybody else?
Yes, ma'am. We have one more, Komla.
Hello, ma'am.
Hello. Yes.
Hi, ma'am.
Hi.
Actually, my problem started when I get married. Before my marriage, my period was it's like a normal for every month. I'm get a regular period. Every
Yes.
month, almost the date will be like 1 or 2 days before or after, like that.
Yes.
And then
Yes.
after my marriage, my
Yeah.
period become the pattern become unregular. I'm start getting like 2 months once, 3 months once, like that. And then
Yes.
I started to see a gynae, and
Yes.
somehow we managed to work it out, and it become normal back. But
Yeah.
then since then it's been 7 years, and until now we never successfully get a baby yet.
Okay. You don't have a baby?
No.
Okay. 7 days of married life, is it?
7 years.
7 years of a married life. Okay.
Yes.
Any issues with your husband?
His sperm count a bit low.
Yeah, both the things should be corrected, ma.
Yeah.
For you, the ovulation should be induced with tablets, and also his spermatozoa count also should get increased. But both the things they will give tablets and simultaneously, and he has to take the proper diet. As I told you, no, you also should do exercise, yoga, and dance or anything, any form of exercise, and see that the lower abdomen fat is not high, and just try
We
and
have been
meditate.
we did take treatment, ma'am. At first they were looking on me. They took a lot of tests, and so after they are very confirmed that my ovulation is okay and everything, then they look for my husband, and for him they give
Wrong,
some tablets.
actually, simultaneously they should examine both the couple and separate the things, right? Yeah.
But it was like that what happened to me. And
Okay.
then after my husband's the sperm count went up a bit, and then they give us like the ovulation date, and then they were guided. The gynae did guide us a lot, and
Yes.
we were never naturally I didn't get pregnant. And then after that they suggested for IUI. And I did about 3 IUIs, and all the IUI I didn't get pregnant as well.
Yeah.
And after that, because the duration is like 7 years, right? So I've been like taking a lot of treatments one by one, and then after IUI, and the last my treatment was IVF. I even take IVF.
Yes.
And even in IVF, the result we got was they say our genetic is not matching, so the baby doesn't grow. I definitely don't understand. Is there such a thing, ma'am?
Such thing will be there. Yeah, because the genotype, no, some chromosomes are. Is your marriage consanguineous marriage?
Come again, ma'am.
Are you related very closely or distantly?
No. We don't know each other. It's arranged marriage.
What is his age?
His age is 38 and I'm 36.
Okay. The chances are less actually. when the chromosomes are not good and genetically if there is any defect, I better advise not to go for a pregnancy naturally. Just wait, let it come naturally and don't go for any treatment. If you are willing to, both of you, if you are willing, you can adopt a child. That is my sincere advice.
Okay.
Yes. Yes.
Actually, that was our family decided, but I'm the one who holding for a year, and I thought I really wanted to give it to spiritual way to maybe I can get a chance of getting a baby naturally.
Yes. Try for that. Try for that. I don't deny. Don't go for any treatment, IVF and all. Stop that, all those things, and just sit and meditate and ask the spirit child and the universe and the universal mother. You must have decided and designed your life in this birth not to have a child, maybe in the previous birth. You don't know, no, you don't remember the previous birth. So you again rewrite your destiny and have a very strong thought that I should get a spiritual baby. Show me the way. If I can get a mother biologically, or are you going to give me a child from the universe whom I can get connected spiritually? Sometimes it happens, no? Suddenly we get connected to someone. We don't know the reason why. So like that also it may happen. Accept it. Accept it.
Okay, ma'am.
You need to
Sure.
be a biological mother. Yeah.
Thank you, ma'am. Thank you.
Telling the other lady also, you can just pamper and nurture a animal or bird or anything, a plant, and grow it like a child, your child.
Thank you, ma'am.
By doing so also, naturally, your hormone automatically, because of that motherly nature, no, because of those thoughts and feelings, naturally some certain things get set right. You see in the movies also, and also the doctors also suggest, why don't you adopt a child? When you adopt a child after 1 year or so, naturally we become pregnant because of that motherliness, that nurturing, and that affection, that those hormones, no, they will separate the hormonal imbalance in you. Like that also it may happen. They are called miracles, and you just sit for meditation and do, and sincerely ask for it, and I hope and I wish that you get successful.
Thank you very much, ma'am. Thank you very much. That's so helpful.
Even if you don't have a child, no, don't get disheartened. And every child is our child only, no. I am having only one daughter, and I wanted only one child. And every child, I feel that like my daughter only, really. I developed that through meditation. So I don't feel that difference between my child and other children.
I do understand that ma'am. I do treat my siblings, my nephews, my niece, all as my child. I treat them as my child. But the thing is that I personally, from the day of my marriage, I wanted to become a mother. I want to have the feeling of having a baby in me.
Of course, that is natural instinct. I don't deny that. But if you, even if you don't get a baby, don't get disheartened. Think that when you are meditating, no, you will have that wide perspective. So broadness, you can Vasudhaika Kutumbam, they say, no. We say Mother Earth. If Mother Earth Bhumata didn't give birth to us, but still we get connected to that mother, that divine mother also, no? Like that. Like that, my own, our own. In this birth, this fellow is my husband. these are our parents, this is my child. In previous birth, after birth, we don't know. We don't relate to each other in any way. That oneness, that attachment should not be there. Get detached and have unconditional love. This is conditional love. Isn't
Okay.
it? My own baby, my own child, my own blood and flesh. Then only it belongs to me, and then only it can love me, and I can have some hold on that. Other babies, how can they, my niece or nephews or my sisters, they won't belong to me, permanently. That feeling will be there. I understand. But don't depend on them. Just give your love. That's all. Don't expect anything back. No expectation.
Yeah. Yes, ma'am. Yes, ma'am. Thank
That is
you, ma'am.
that.
I'll definitely have that in my thought, ma'am.
Yeah, with meditation, you one day you will get that enlightenment. I don't
Yes.
know, cannot say when, but definitely practice meditation.
Thank you, ma'am. Thank you, ma'am. Actually, starting this year,
Maybe
we already stopped all the
get
treatments.
married, maybe you are destined to serve universe, do any major things for which this can be this responsibility of the baby, maybe an obstacle, maybe because of that you might have chosen your soul might have chosen this path to have this experience, not having a child, thing like that. Yes, can be.
Thank you, ma'am. Thank you. Thank you very much.
Welcome. Anybody?
Am I audible?
Yeah,
Yeah,
ma'am.
yes, audible.
Okay, ma'am. Ma'am, from January, like I had a heavy bleeding. I diagnosed with endometriotic cyst in both the ovaries. Only one cyst were there in both the ovaries. I had started taking a medicine. Now,
Yes.
after 5 months, like one of the cysts is gone. Now both are gone. But still my lower abdomen fat is like, it's still there. I'm a regular yoga practitioner from past 3 years. But still, I like you were recently telling, no, you shouldn't have that lower abdominal fat.
Yes, yeah.
But I'm practicing whatever I can do, but still I'm not able to get rid of it.
Yeah. You do Mandukasana and Baddhakonasana and Pavanmuktasana and Dhanurasana and Ustrasana, and also
whatever you said, I'm doing all those asanas.
Cut down on carbohydrates. Take very little of rice and take lots of vegetables. This much of vegetable and only this much of rice.
Acha.
Okay. Take the dinner very early. That is before 7 o'clock, 6:30 or so, and breakfast at around 7:30 or 8 o'clock. So intermittent fasting, they say. So the stomach will be empty throughout this. You can drink any amount of water if you want, but do like that. And check your hormone levels also. Maybe you are having any hypothyroidism or something like that.
Yes, ma'am. I'm having hypothyroid from 7 years. I'm having.
Because of that also, that fat deposition will be there.
Oh, yeah, that is there.
Flax seeds, I am telling flax seeds, flax seeds and pumpkin seeds and chia seeds, they reduce your weight also.
Weight is okay, ma'am. Like it is, I'm not that increase like once. It is constant.
Okay.
It's constant.
Okay. Lie down on the prone position and do Dhanurasana.
Yes, ma'am. I'm doing yoga. I'm very regular in that.
Yeah. No problem, ma'am.
We also are planning for pregnancy from past many years, ma'am, yet not successful. But from past 1 year itself, I'm meditating now.
Yeah. Do continue your meditation, and both of you, it's better to do meditation during the night, husband and wife. And whenever possible, you sit in meditation and ask for it.
Sure, ma'am. And the message you just said, no, I treat every child as my own child. That was really motivating, ma'am.
Really, ma, really do like that. Then dissatisfaction won't be there. I'm not telling you actually, but the situation has come because I'm telling everybody, actually the marriage also should not be for the sake of the family or the society. See, you should, after a certain age, you should get a job, you should get educated, you should get married, and should get children and all. This should not be there. Everybody is unique, and every soul has its own plan and design. So it's not for the sake of the society or mother or father or in-laws or husband, you should think that I should get pregnant. You feel that I should have a child biologically, and I want that motherhood. I want to enjoy that feeling. I want to have that experience, and I want to give birth. I want to bring that divine child through me to the earth. I want to become that carrier. I want to have that entry point to allow them through me. They are not our children because they come through us. That thing we should remember. Even if you have a child, that child is not yours. That child has selected you as a path to come unto the earth, and the child's path and design and everything, her education, his or her education, or her qualities, or behavior, or job, or anything, you cannot decide. It will decide on its own. You are only a vehicle, a door to pass from this side to that side. That's all. So have that perspective. Then you don't have that much of passion that everybody is having, and everybody is having that motherliness. Their amma ani pilpu kavali. All these things. No, don't have that. See,
by the time actually from beginning till now, like we have learned so many lessons, that craving that has reduced a lot, I can say, ma'am.
Oh, okay. If you are still having, just sit and ask in the meditation, why I'm having this much of craving, because in the past lives, am I deprived so many times? Did I lost so many children? Are my children dead, or somebody killed my children, or what? Or did I kill any children, or did I did do any harm to any pregnant lady by mistake, knowingly or unknowingly in my past lives? If that is so, please clear all this karma, and I am letting go of all those imprints from me. And now I am fresh and pure, and I clean everything, and now freshly I am asking for a child. Please do come. Like that you ask and pray. Then let us
do.
Okay?
Yes, ma'am. Thank you so much.
Thank you.
Soumya, you want to?
I just spoke, ma'am.
Soumya?
Yes, ma'am, I just spoke.
Okay. What is it? Anybody want to speak with madam? Please raise your hand.
Actually,
so that we can
I
unmute
have a
her.
doubt. In case if I get pregnant, so there will be chances of miscarriage, ma'am?
Any problem with you in health, any health issues are there for you?
No, actually, no health issues, ma'am. Only vitamin D level is low. So in case if I get pregnant, so there will be miscarriage, ma'am?
No, why can't you wait for 2 or 3 months? It won't take much time, because weekly once you are taking the vitamin D supplement, no. After 2 months, I think you should be normal. After that, you can try. Because not miscarriage, need not be miscarriage, but the neural tube, that is the central nervous system, the brain and spinal cord, they develop in the first 3 months of our pregnancy. So that will be defective. We don't want a defective child, or ill-formed child, or mental retarded child for us, no, throughout the life. So it will be a burden for the baby and us. So to have a healthy child, I suggest you to wait for some time and then get your vitamin D levels checked, and then take the advice of the doctor. And your hemoglobin also should be right. And I forgot to tell one thing, my dear friends, your folic acid also should be normal. Before conceiving itself, when you are planning itself, before 6 months, you start taking folic acid rich food or folic acid supplements. Not after becoming pregnant. Before itself, you have to start this high protein diet, iron rich diet, and also this folic acid.
Yeah, ma'am. I'm having folic acid tablets, ma'am.
Yeah, you should take.
I'm having the tablets and vitamin D tablets also weekly once.
Yeah, it's good.
That's what. So I should wait, ma'am.
Yeah, please wait.
Yeah. Okay.
The pregnancy is very precious. No, why to take chance?
Yeah.
Yes.
Okay, ma'am. Thank you.
Thank you so much, madam, for the precious knowledge and also for the divine scientific knowledge you have given for everyone. Thank you so much, madam.
Thank you for giving me this
Swati, we have other one. Ma'am, we have other one person.
Okay.
Yeah.
హాయ్ మేడం.
Hi.
వాకింగ్ అవన్నీ చేయొచ్చు కదా మేడం ప్రెగ్నెన్సీ ప్లాన్ చేసేటప్పుడు, యోగా గానీ వాకింగ్?
శుభ్రంగా చేయొచ్చమ్మా. వాకింగ్ is very good, very good. We should do actually yoga and walking while planning for pregnancy. If it is a very precious pregnancy and unless డాక్టర్స్ వద్దు ఎర్లీ ప్రెగ్నెన్సీలో అమ్మ నువ్వు బెడ్ రెస్ట్ తీసుకోవాలి, నీకు ఏదైనా బ్లీడింగ్ అవుతుంది అని చెప్తే తప్ప అన్ని ఎక్సర్సైజెస్ చేయొచ్చమ్మా. చేస్తేనే మంచిది.
పొట్ట ఉంది నాకు కొంచెం మేడం, యోగా పొట్ట ఎక్సర్సైజెస్ కూడా చేసుకోవచ్చా?
చేయొచ్చు. నేను ఇందాక చెప్పాను ఇంకో ఆమె కూడా, రైస్ బాగా తగ్గించేసేయండి, కర్రీస్ బాగా ఎక్కువ తీసుకోండి, ఫ్రూట్స్ తీసుకోండి, ఫ్రూట్ సలాడ్, వెజిటబుల్ సలాడ్స్ తీసుకొని బాగా మంచిగా తాగండి, తగ్గిపోతుంది పొట్ట ఉన్నదేమో.
ఓవ్యులేషన్ డే ఆ 2 రోజులు కూడా చేయొచ్చా అండి? అంటే ఓవ్యులేషన్ డే ఆ 2 days ఉంటది కదా, ఆ టైం కూడా వాకింగ్, స్ట్రెయిన్ అవడం, స్టెప్స్ ఎక్కడం
చేయొచ్చు. అన్లెస్ షీ హాస్ సమ్ డిస్కంఫర్ట్ ఆర్ పెయిన్ ఉంటే వాకింగ్ చేయొచ్చు. వాకింగ్ కి పెద్ద డిస్కంఫర్ట్ ఏమి ఉండదు కదా, ఉండదు. యోగాసనాలు అంటే ఇట్లా పొట్ట మీదకి ఇలా మడుచుకుని చేసుకునే పొత్తి గడుపు నొప్పి వస్తే కొంచెం షీ కెన్ స్టాప్, అదర్వైజ్ షీ కెన్.
ఓకే.
ఓకే, థ్యాంక్ యూ మేడం.
థ్యాంక్ యూ అండి.
ఓకే
మేడం. యా, థ్యాంక్ యూ మేడం. అయిపోయారు. Thank you so much, madam. Thank you once again for coming and sharing the wonderful knowledge.
Swati, కనిపించట్లేదు. వీడియో కనిపించట్లేదు. Yeah, I can see you now.
Thanks for sharing wonderful knowledge, madam. It was very divine knowledge and scientific reasons was very amazing scientific reasons, and the doubts you clarified was amazing, madam. Thank you so much. Thank you so much for coming.
Thank you for giving me the opportunity to share and clear the doubts. I hope I cleared and clarified some of their doubts, and mainly the perspective should change, ma. Should not feel low or insecure, even if you don't have a child. So better to change our outlook. That's what I mean. Yes. Thank you.
Let's close the session, madam.